This is especially important for those of us dealing with health concerns including heart, diabetes or metabolic syndrome. Before you jump into your next workout, let's talk about exercise precautions. Trust me, this info could be a game changer for you. Always start slowly and build up over months, days or weeks. Check with your healthcare team about what kind of exercise is allowed. Have somebody with you in case you need any help. Make sure you have a fully charged phone in case you have to call an ambulance. If you have heart issues, better not to participate in any kind of competitions even between friends and family. Let's kick things off with some eye-opening stats. In 2022, about 3.6 million people ended up in emergency rooms due to sports and recreational equipment injuries. Exercise-related injuries were among the top culprits. But don't worry, we're not here to scare you away from exercising. We're here to help you do it safely and effectively. For those of us dealing with metabolic syndrome, exercise is like a superpower. It works to improve insulin sensitivity, lower blood pressure, and help manage weight. But it's crucial to approach it the right way. First up, let's talk about warming up. It's not just a time waster, I promise. Warming up is like giving your body a gentle wake-up call. It slowly increases your heart rate, breathing, and body temperature. This simple step can really lower your risk of injury. A study found that people who warmed up before workouts had fewer injuries overall. And when they did get injured, it wasn't as bad as those who skipped the warm-up. So, take a few minutes to do some light walking, gentle arm circles, or easy stretches before you start your main workout. Wait, there is more, but do not forget to hit the like button if you have found this video useful so far. Thus YouTube will serve more videos to suit your interest on similar topics. Now, let's chat about what to wear. Your workout gear matters, especially if you're dealing with health issues. Wear comfy clothes that let you move freely. And don't forget about your feet. Good shoes that support your heels and arches are super important. If you have any foot problems related to metabolic syndrome, like neuropathy, proper footwear becomes even more crucial. Alright, let's move on to the actual workout. Listening to your body is key, especially when you're managing a health condition. If you feel dizzy, short of breath, or have chest pain, nausea, or unusual muscle and joint pain during exercise, stop right away. These could be signs that something's not right, and it's always better to be safe. Here's something many people overlook: the weather. It plays a big role in how safe your workout is. We need to be extra careful. Exercising for more than 30 minutes when it's 27 degrees Celsius to 29 degrees Celsius, about 80 degrees Fahrenheit to 84 degrees Fahrenheit, and the humidity is above 70% can be tough on your body. This is especially true if you have heart issues or are at risk for them. On hot days, try to exercise early in the morning or in the evening when it's cooler. Or better yet, take it indoors where you can control the temperature. Now, let's talk about how much exercise you should be doing. The World Health Organization suggests adults aim for 150 to 300 minutes of moderate intensity exercise per week. That's about 30 to 60 minutes a day, 5 days a week. But if you prefer more intense workouts, you can aim for 75 to 150 minutes per week instead. Intense workouts may include things like mountain climbers, jumping jack, jumping lunge, high knees, squat, jump rope, push-ups and so on. But here's the good news: you don't have to do it all at once. The latest guidelines say that any amount of physical activity counts. So, if you can only manage 10 minutes here and there throughout your day, that's still great for your health. Let's not forget about strength training. It's not just for bodybuilders. It's super important for managing metabolic syndrome. The WHO recommends adults do muscle strengthening activities at moderate or greater intensity, involving all major muscle groups, at least 2 days a week. This could be using light weights, resistance bands, or even your own body weight. Now, I know some of you might be thinking, but I have health issues, should I even be exercising? The answer is usually yes, but with some precautions. it's crucial to check with your doctor before starting a new exercise routine. They might recommend a thorough checkup, especially if you are planning on more intense activities. Here's something else to keep in mind: your medications. Some meds can affect how your body responds to exercise. For instance, if you are taking insulin or other medications that increase insulin secretion for diabetes, you might need to adjust your dose to prevent low blood sugar during workouts. Take some healthy carbohydrate foods with you in case you get a hypoglycemic event. If you are on beta blockers for high blood pressure, your heart rate might not be a reliable indicator of exercise intensity, so you'll need to rely more on how you feel. Let's talk about a common issue: overtraining. Yes, there is such a thing as too much exercise, especially when you're managing a health condition. Overtraining can lead to feeling constantly tired, decreased performance, and increased risk of injury. If you find your energy levels dropping or you are always feeling exhausted, it might be time to dial it back a bit. Here's a tip for preventing overuse injuries: mix up your routine. This means doing different types of exercises. Not only does this keep things interesting, but it also gives certain muscle groups a chance to rest while you work on others. Now, let's address something super important for metabolic syndrome: hydration. Your body needs fluids to function properly, especially during exercise. Make sure you are drinking water before, during, and after your workout. But be careful not to overdo it, as too much water can also be harmful. Here's an interesting fact: did you know that exercise can affect your immune system? Moderate exercise can actually boost your immune function. But long, intense exercise without enough rest can temporarily suppress it. So, if you're feeling under the weather, it might be best to take it easy or skip your workout that day. Let's talk about recovery. It's just as important as the workout itself. Your muscles need time to repair and grow stronger after exercise. Make sure you are getting enough sleep and consider adding rest days to your routine. This is especially important when you're managing a health condition. Now, I know we've covered a lot, but there's one more thing I want to mention, and that's progression. When you're just starting out or getting back into exercise, it's tempting to go all out. But this is a sure way to get injured or burnt out. Start slow and gradually increase the intensity and duration of your workouts over time. This is particularly important if you're dealing with metabolic syndrome or other health concerns. So, there you have it, folks. A guide to exercise precautions, especially for those of us managing health concerns or metabolic syndrome. Remember, exercise is incredibly beneficial for your health, but it's important to do it safely. Listen to your body, warm up properly, wear the right gear, and don't push yourself too hard too fast. Before we wrap up, let's quickly recap the key points. 1. Always warm up before exercising. 2. Wear appropriate clothing and supportive shoes. 3. Listen to your body and stop if you feel pain or discomfort. 4. Be mindful of the weather conditions. 5. Aim for 150 to 300 minutes of moderate intensity exercise per week. 6. Include strength training at least twice a week. 7. Check with your doctor and health team before starting a new exercise routine. 8. Be aware of how your medications might affect your exercise. 9. Avoid overtraining by incorporating rest days and mixing up your routine. 10. Stay hydrated. 11. Allow time for recovery. 12. Start small and progress gradually. Exercise is a journey, not a race, especially when you are managing health concerns. Take it one step at a time, and you'll be amazed at what your body can do. Stay safe, stay healthy, and most importantly, enjoy the process. Do not forget to click the like button and subscribe. On the screen, you see a video related to some other health topics.